Hello, my name is Sharon Stern and I'm 76 years old. I was diagnosed with a reproductive cancer in August of 2014 and learned later after surgery that it was stage 3C, primary peritoneal cancer, high grade serious. My story is not unlike others with the vague symptoms that I experienced prior to my diagnosis. It started with a tiredness that I chalked up to my age at the time, 69. For about a year, I had battled up to 12 times daily some diarrhea. So having had a well-regarded gastroenterologist, I consulted with him and he put me on various treatments that would correct it for a while, but it always seemed to come back. I was a person who had always eaten well, maybe a little too much, but I had always practiced good nutrition, exercised up to 6 times a week, never missed a doctor's appointment, always got my vaccines. But finally, my husband and I took a vacation of up to 2 weeks where I didn't have to do anything but show up, and I realized how tired I was. So I came home from that vacation in 2014 and went right away to my internist thinking I had a low thyroid or possible anemia. With my gynecologist, I had seen her every year, but at my last visit, because of my age, she said, "You have not had an irregular pap smear, so you can come every 2 years because Medicare won't pay for the pap smear." Had I gone, things might have been a little bit different. But back to my internist, he told me that the thyroid and anemia tests showed nothing unusual. But he did listen when I told him I just didn't feel like myself. And I wondered if it could be my gallbladder. He was as shocked as I was when the report came back from the radiologist that I had 4 large tumors in my abdomen. When you hear that you have cancer, your whole world changes. Everything changes, from the smallest detail to the greatest. You cannot change the diagnosis, but you can control how you handle it and how you go forward. So my internist was able to get the lab that did the blood work to run a CA 125. It showed a level of 700, and as many of you know, anything under 36 is normal. So armed with all of these items, the radiologist's report on the scan, the blood work, and the biopsy, I was fortunate to be able to interview 2 female oncologists. And I got a port the very next day, and I started on a radical plan of dose loading, which is chemo every week with carboplatin and Taxol to reduce the tumors before surgery. But I had surgery in 2014 with a radical hysterectomy, followed by 6 weeks of rest, and then I went on a very extreme program of IV for intravenous, IP for intraperitoneal chemo. I have to say, when it was over, I thought I'd conquered cancer. I had done everything that I was supposed to do. I felt like it was over. I was going to live my life again. I appreciated all the things in my life on a different level, from the small things with my grandchildren to flowers blooming. I'm still in what I refer to as Wiggy. Wiggy is now my best friend. It's wash and wear. It gets me ready in 5 minutes. I used to spend way too much time on my hair. Then 2 years later, my cancer reappeared. It reoccurred in my abdominal cavity. It was found in an isolated scan, and it showed a tumor on my liver, on my spleen, and in a very difficult area near my small intestine. I was back on a chemo cocktail of Gemzar, Avastin, and carboplatin for 9 months, or as my white blood count would allow. While the tumors on my liver and spleen disappeared, the one near my small intestine remained. And since then, when a cancer has reappeared, I was on maintenance chemo, which means probably chemo or some form of treatment for the rest of my life. In December of 2019, my blood pressure started to rise and my kidneys started to fail on the Avastin, which is what happens with many of the chemo drugs. I am now a high-risk patient that had a recurrence in 2 years, and this changes your diagnosis. I have now had a scan that shows I'm tumor-free, but I'm under no illusions I couldn't have a tumor again. So in total, I've had 73 rounds of chemo, and that accounts for 173 separate infusions. I've had 10 stereotactic radiations, a PARP inhibitor, and multiple oral chemos. I'll be on some form of treatment or maintenance for the rest of my life. But I thank God for modern medicine, which has kept me alive. 20 years ago, my prospects would not have been so good. New research gives all of us new hope for the future. As I've said, cancer changes you, and you'll never be the same person. But I am a wiser person for having had cancers. And I can see now more clearly how to appreciate life. And I have more humor about all these issues. Thank you.